Good afternoon, everyone, and thank you for joining us. I'm just going to let folks trickle in, and we'll be beginning in a few short seconds. Okay. Good afternoon and welcome to the Leadership Checkup Series hosted by the National Council for Behavioral Health and the Association of State and Territorial Health Officials. Thank you for joining us today. Before we get started, I'd like to quickly run through a few housekeeping notes. To access audio for today's presentation, you can listen through your computer speakers by clicking the Join with Computer Audio option in your Zoom window, or you can join by phone by dialing the number shown on your screen. Upon entering, you will be automatically muted. We ask that you please keep yourself muted for the duration of the webinar. Today's webinar is also being recorded and will be archived for future viewing on the National Council and ASTHO's websites. The Leadership Checkup Series is a collaboration between ASTHO and the National Council's Behavioral Health Training Institute for Public Health Officials, designed to support state, local, tribal, and territorial health officials through this unprecedented public health crisis. The goals of the Behavioral Health Training Institute are to increase the knowledge, skills, and abilities of public health practitioners and workforce to improve and enhance behavioral health strategies within public health settings. Today's presentation, titled Crisis Leadership and Resiliency, a Trauma-Informed Approach to COVID-19 Response, is presented by Lisa Guroff, Director of Trauma-Informed Services at the National Council for Behavioral Health. Lisa has over 25 years of experience in the behavioral health field, providing direct clinical services, clinical supervision, and administrative direction. She has worked in a range of clinical settings, from treatment foster care to outpatient mental health to a variety of residential settings for children and adults. Prior to joining the National Council, Lisa was the COO of a large mental health provider where she oversaw and directed the implementation of trauma-informed care practices across the agency. At this point, I'd like to turn it over to Michael Frazier, CEO of ASTHO, to provide some opening remarks. Mike?
Thanks so much, and good afternoon. If you're in the East Coast time zone, hafa adai if you're a colleague out in Guam or the Marianas Islands, and good morning for those of you on the West Coast and other Pacific time zones. I'm Mike Frazier here at ASTHO, the Association of State and Territorial Health Officials. And I just want to say hello and thank you for taking a little bit of time to think about yourselves in the midst of this current pandemic. This is the second of a number of different events that we're co-hosting with the National Council for Behavioral Health. And the first one was a huge success, and you're about to learn a lot from Lisa, who's a fantastic presenter with a lot of information. We talked prior to this call. When we spoke prior to this call, Lisa was mentioning we had, or Taslim was mentioning, we had over 3,700 people register for this, and we're at over 1,000 participants right now. And I think that speaks to where we are right now and the interest and relevance of this topic: crisis, leadership, and resiliency, a trauma-informed approach to COVID-19 response. So thank you, Lisa, for putting your knowledge together to share with us, and thanks to our partners at the National Council for all that they do to support our membership and to support their members and help us help others. Thanks, Lisa. I'll turn it over to you now. I think you're on mute.
Thank you. Sorry. For those of you who joined us last time, we talked a lot about the importance during this time of emotional regulation, and that really before we're able to do anything else cognitively, we really have to be in a calm state. So we started last week with a meditation. We're going to do the same today and go back to our permission slips, which as leaders, I would definitely encourage you to take whatever you can from today and make sure that you're incorporating it into and know that you have permission to incorporate all of these into your own practices with your staff. So the first thing I'd ask is that everyone just get comfortable, find a space where you are so that you are able to kind of just take in the next couple minutes of the meditation, and then we will start. Casey, are you able to turn the sound on for us?
Sure, give me just 1 second. Go ahead and let's try this now.
Remember that you're a priority, and allowing yourself even just a few short minutes of intentional reflection can really have a positive impact on the rest of your day. So let's use these next few minutes to come back to center and set an intention for the rest of your day. Move into a comfortable position, whether you're seated at your desk at work or laying on the couch at home, and gently close your eyes and shift all of your attention onto your breathing, taking slower, deeper breaths than you've taken all day so far. Taking a deep breath in through your nose and slowly letting it out through your mouth. And continuing to breathe that way, feeling your lungs expand out as you inhale and contract back in as you exhale. Tune into your body, noticing how it feels. Noticing if there's anything that it's trying to tell you. Notice any place of tension or tightness in your body. And give those areas permission to relax, sending love into those areas. Thank your body for taking such good care of you, and let it know that it's okay to rest and relax for these next few minutes. You may notice that your mind starts to wander off. That's okay. That's natural. Just notice it and bring your attention back to your body, using your breath as your anchor. Try to picture one thing that's happened today that's made you smile, or made you thankful or appreciative. And just let that feeling fill you up for a moment. Breathe that feeling in from the top of your head to the tips of your toes. And allow yourself to smile if that feels natural. Now focus on something that you can do today, whether it's for yourself or for someone else, that will allow you to continue feeling this way. It could be something as small as deciding to go to bed early tonight, so that you have time to finally read that book that's been on your bedside table. Or the joy of getting dinner with a close friend. What's one little thing you can plan for your day to bring that intentional joy to it? Now just focus on that for a few minutes. Sit in that feeling of joy and peace. take a few more deep breaths together. A deep breath in, feeling your lungs expand out as you inhale, and everything contract back in as you exhale. Again, an even deeper breath than the one before it, holding that breath for a beat, and exhaling everything out. Last time, your deepest breath yet, sending that breath through your entire body. And exhale it out, and in your own time, slowly bring your awareness back to where you are. And thank yourself for taking these few minutes to just be intentional and kind to yourself. And when you're ready, you can gently open your eyes and enjoy the rest of your day.
Lisa, you're on mute.
Thank you. Sorry. Trying to relax myself. So thank you guys for joining me for the for that meditation and just that time. And a reminder, like we talked about last week, or our last session, about how important it is for your body to be in a space that you can be relaxed, so that your mind can really access higher levels of thinking. When we're talking today about crisis leadership, if you're not calm, if you're in crisis, then you're not going to be able to really lead in a healthy and productive way. And so we're going to talk about that today. So thank you guys. And as leaders, so important that we're doing this, that we're practicing it, that we're modeling it for our staff. And so any of the resources that we go over today are public domain and definitely things that you guys can use with your own staff. So as we did last time, also this question for you about what do you need to give yourself permission to do for the next hour so that you can be completely engaged in the information that we're talking about. As we know, many people are multitasking at home. We've got children and animals and spouses, and maybe people are even in your house doing some work, or the neighbor's mowing the lawn. And then your phone is constantly, we've got messages coming in from work and from teachers and from our family members, our friends. So what do you need to give yourself permission to do in the next hour to just be fully present? And if you can share a couple of those with us in the chat box. Casey, if you can share kind of where people are and what they're giving themselves permission to do so that we can be fully present for the next hour.
It looks like a lot of people have been turning off their phones, or at least putting them on silent, really giving themselves permission to take time away from checking email, looking at texts, trying not to multitask and focusing on one task at a time, keeping the news on, but at a very low volume, so it's not just like blaring in your mind. There's a lot of sitting outside in the yard or going out into nature, having coffee, going on daily walks. We have some yoga and mindfulness.
Those are all great.
Yeah, trying to give yourself the full attention to whatever task you're working on at that moment.
Wonderful. Thank you guys for sharing. This activity comes from Brené Brown, and definitely something I would encourage people to look at doing in terms of starting meetings really intentionally for just a given period of time. And, you know, sometimes it might be the reverse of turning things off, but really, you know, I'm a mother of 4. Sometimes I need to give myself permission to not be mom. And sometimes I need to give myself permission that if in the middle of that meeting, you know, something happens and I need to respond to it, that that's okay too. So wherever you are, thank you guys for joining and for taking that moment to really just think about what you need to do for yourself to be present for today. So today's focus is really about understanding through COVID how we can really provide leadership in a trauma-informed, resilience-oriented way. And so the first couple slides, you guys will have access after this to all of these slides. We'll spend some time on some on more or less. But so you guys know, this is not new now. We have been going through COVID and the response to this, you know, for multiple months now. So we know it's a stressful situation. We know the impact that it has on our relationships and our loved ones and our eating patterns and sleeping patterns and those of our staff, as we're all trying to find a way to manage in this really toxic stress place. And so how do we do that, right? How do we recognize what is specific to COVID and our response to that? And then how do we respond in a way that's really helpful to our staff? So we have in here, you know, the different ways in which we can respond to stress, things that are, you know, we talk about not just physically distancing, but media distancing, taking time out for yourself, connecting with nature, being kind to yourself and recognizing you're in the midst of a crisis, trying to do work, trying to manage all these different things. And so taking those breaks are going to be really important. So when you do intervene, whether it's with a loved one, whether it's at work, you can intervene from a really positive, helpful place. And recognize, you know, we're all human. So we're not always going to be at our best, and that's okay. Please make sure to give yourself time. The other piece back here at the end of this slide about taking care of your body and your spirit. I can't emphasize enough for you how important it is to do these things, because the body you have now is the one you're going to have at the end of this time when we move to whatever that new normal is, that hopefully better normal. But we want to make sure that your body and spirit are really maintained well during this time. And so that's why it's so important that you find moments throughout your day for yourself, for your staff, for your children, your loved ones, to regulate emotionally. Because if we don't regulate during this time, you will end up burning out. You will end up on the other side of this at a different regulated state permanently. And we don't want that to happen. So really important that you're doing those things. So during this time, during this crisis, and in crisis in general, how can we respond in a really trauma-informed, resilience-oriented leadership perspective? And so the role of our leadership in crisis is really absolutely championing self-care by example, leading through relationships. We know that our power is in those relationships, in healthy relationships. Regulating, providing those regulation moments for those that you lead. And we're going to talk about how to do that in a really trauma-informed way. So what does this look like? Well, the first thing, as you see on here, is really walking the talk. We cannot say to our staff, to those that we lead, to take care of themselves, to take moments to regulate, that it's okay to take time off and disconnect from email, to walk out in nature, or to manage their work schedule in a different way, if we're not doing the same thing. Because your staff and those that you lead are watching you. And so if you don't do it, they're not going to feel like they have permission to do it either. So it's so important that as you're talking to people about getting sleep, taking care of themselves, finding times to, whether it's meditation or yoga or centering themselves, however they find the way to center themselves emotionally, that you're doing the same thing. Or your staff and those that you lead aren't going to follow you because it's going to be just lip service. And they're going to feel that discrepancy. The next thing that we want to do is really focus and lead through relationship. And so I want to take a pause here and really go through those trauma-informed, resilience-oriented principles that are so important that we embrace during this time. So when we talk about safety, we need to prioritize physical, emotional, and moral safety in all of our interactions. And we will continue to talk about the importance of understanding moral safety and the risk of moral injury, especially during this time. It is so highlighted. And so making sure that we're keeping people apprised of how to do that, doing that through best practices in terms of working remotely, trusting our staff to bring their best selves and to also reach out to us when they need our support. Making sure that we're not micromanaging and giving a message to our staff that we don't trust them. Modeling vulnerability, checking in with people on a regular place, recognizing that you might need a break too, and that it's okay and really actually important to your staff that you say, you know what, in the next 10 minutes, I need to take a break for myself, and I'll be back, and I'm coming back, but I also need to regulate. As you can see on the bottom down here, regulate, regulate, regulate. We really understand now the importance of emotional and brain regulation on an ongoing basis during these toxic stress, high crisis moments. And if we don't do that, we lead to burnout. If we don't do that, we're going to regulate ourselves onto a different level is a permanent state. And we'll talk about that. The other thing we want to look at is trust and transparency and recognizing how important this is during this time. So in the moment of crisis, when we don't know what's going on, as humans, we start to make up stories. We start to go down rabbit holes of our own anxiety. So it's so important that we're sharing this information with our staff. Recognize that they're going to be okay. They can handle difficult news. You know, really important that we're keeping them abreast of what's going on, as opposed to as leadership holding on to information. Those daily check-ins, whether you're doing huddles, sharing information, you know, so important that we are sharing that information in a in a transparent way, that we're showing them how the stew's getting made, how we're making decisions, so that they can also be part of that decision-making process. Examining our current expectations. Are there things that you need to realign or readjust during this time? You know, if someone has to work on an alternative work schedule, you know, is there a project that maybe might be better suited for that work schedule that someone else has and that is working a more traditional schedule, and we might be able to swap projects? Really starting to open up a broader understanding of what everyone brings to the table and how we start to really bring everyone's strengths during this time. The other principle is collaboration and mutuality. So important that we're allowing for social interactions. As we have moved from a lot of office-based, people commuting on buses and going out to lunch and having just connections and interactions with other humans, we're missing that now. And so how do you find time for your staff and for you to connect socially with other humans? It might be like allowing your staff access to work Zoom after work for them to stay in touch with their family members. Daily check-ins. We had some really creative people or groups doing things like scavenger hunts through Facebook for both their clients and their staff. You know, just different ways in which we can find some of that downtime that we really are missing. At the National Council, we talk a lot about we don't want you to socially distance. We want you to physically distance and stay healthy, but please do not socially disconnect. Please make sure that you're finding ways on a regular basis. As humans, we thrive in relationship. We are not isolative creatures. And so important that we're finding really creative ways to connect. One of the groups that I consult with is actually setting up a online Zoom room, which people can just go socialize in. Whether it's called you set it up as a lunchroom, if that's where people, started to meet up. We have some people doing water cooler, connections on Zoom, setting up relaxation rooms, that if I'm having a difficult time at work, I can go into this Zoom room and really get kind of, maybe it's the meditation or the waterfalls, but just a place to connect with other people and to relax. And so really encourage you as leaders to tap into all of that creativity that you guys have. And then finding really important ways to connect and partner with staff, not just on work, but as you can see here, we've had pet competitions for photos or child photos using humor. We talk about, all of the new coworkers that we have, whether they're four-legged friends, or children or spouses, that we're seeing a different side of people at work. We have cooking groups that are starting up and discussions about different gardening tools and techniques. So important that we find ways to really connect during this time and level that playing field. As leaders, if we can just be part of those fun photos, if we can be part of the scavenger hunts or the discussion about the, sharing recipes, it starts to really build again on the importance of those relationships, and leveling that playing field, that we're all human doing the best we can to get through this right now. The other principles are voice, choice, and empowerment, and cultural and historical and gender issues. So important right now that we're finding ways for staff to share their input. And, one of the importances of this is, whether it's during a crisis or other times, that when we experience trauma, and we're in the middle of it, right? We're in the middle of this complex trauma as a community, both personally and nationally. What happens is we lose our voice. Things start to happen to us, and we don't feel like we have control over that or really the ability to manage that. And so the more we can infuse that into our staff's daily practices, giving them a place to have a voice, to offer, as you see on here, alternative work schedules based on their needs, normalizing the grief that we're all experiencing about the losses that we have, whether it's relationships or connections or, even just for some of us who, had long commutes. I used to travel a lot for work. I haven't left my house for, months. Those were downtimes for me. Those were times where I could check up and check in with friends, or, I didn't have my children in the background also needing things. Those are losses. I enjoy seeing people. I enjoy being in rooms with people as opposed to just doing all of our trainings over, over Zoom. And so normalizing that process. There are some incredible things that we have gained during this time, and there are things that we've lost. So checking in with your staff and really giving them the ability to share that. Make sure that all of your staff know about your EAP services. We have people who have never experienced significant depression or anxiety, and it really has been difficult for them during this time because they've started to experience that and don't know, what those resources are out, or those who have struggled with mental health issues prior to going into this. It's really exacerbated some of those symptoms. The other piece is recognizing your own privilege, making sure that in everything that we're doing, that we are practicing cultural humility. Cultural humility is really about understanding myself first, my biases and my privileges, my culture, my perspective. We all have those things, so important that we are recognizing those and then understanding others' experiences. listening to understand as opposed to listening to respond, and really starting to understand their perspective, know what they're experiencing. Privilege can be also in terms of access to resources or internet or computers at work, being in a place where I can shut the door and, focus just on what I need to focus versus needing to, I'm privileged enough right now to not have young children at home. My children are all in their teenage and college years. So I don't have a kindergartner that requires me to sit next to them while they're also doing their work and I'm trying to do my work. That I do have enough access for my children to get on and do their work separate from needing to use my work computer. All of those different things, right? And once we understand someone else's perspective, then we need to do something about it. Being culturally humble also means taking those equity and social justice positions to level that playing field, to make sure that we're all have access to all of those different resources, and doing something differently so that we can all fully participate and contribute, as you can see here. Some of it is also knowing when decisions and how decisions are made. If I work in an organization and I don't know that budget decisions are made in March, to start a budget right now, in July, then I'm going to come up with something in June and say, why can't we do that? I need to have all that full information about how the organization works, about how those different decisions are made and what, who those decision makers are, so that I can fully participate. So it's some of those things that we have to pay attention to as well. This is excuse me, went too fast. This is our model for trauma-informed, resilience-oriented leadership. And what you'll see on here are the 4 components that we really focus on. We just talked about those trauma-informed care principles. It's really important from a trauma-informed, resilience-oriented lens that we're practicing adaptive leadership skills and understanding those, developing and supporting a fostering supportive environments perspective, which really leans into diversity, equity, inclusion, and opening up those collaboration practices. And then also understanding from a leadership perspective how organizations change, how we manage those different types of components. There is a whole science behind organizational change with sustainability, and so we need to know about those and we need to practice those. So today we're going to kind of focus on some of those fostering that supportive environment and some of the skills under adaptive leadership to really focus on while we're managing during crisis. The other thing I want you to recognize is this quote that we have here, is that we are in the midst of a toxic stress, complex trauma experience. And so we have here from a reminder from the California Surgeon General, Dr. Burke-Harris, right? We're all feeling a lot of stress right now, and it isn't all in our heads. Our bodies are actually producing more stress hormones. So important that we recognize that we're not at the beginning of this trying to figure out what's happening. We're in the middle of this, really trying to manage. And as it goes on, and the longer it goes on, the more our bodies are consistently bathed in those stress hormones, which, as we were talking about earlier, can really alter how we come out of this and alter our bodies, and we don't want that to happen. We really want to come out for ourselves and our staff in a post-traumatic growth perspective as opposed to a burnout perspective, where the impact of this has really, has a negative long-term impact. So this comes from Dr. Bruce Perry, and a lot of his work on the importance of emotional regulation and focusing really on that bottom up. So these are an example of the brain. And as you can see, the colors are where more of the activity is going on. So on the left here, we have a lot more color in and blue in that neocortex. And this really represents someone who's emotionally regulated. That a lot of their energy, their brain focus is, you can see, in the higher functioning parts of their brain. On the right, you can see the colors are reversed. And so we have someone who's really emotionally dysregulated at this point. And more of their energy is really in that fight, flight, or freeze space. And so what this is letting you know, and what Dr. Perry's message to all of us is that if we can stay calm and regulated, that we can actually have an impact on someone who's dysregulated, someone who's stuck in more of that fight, flight, or freeze space. We can help them come out of that into a better place. Unfortunately, if we are dysregulated ourselves, we are never going to be able to calm someone else down. So let's talk about what that looks like and what that means. And this information is from Dr. Perry. So in this first slide, we have, and he talks a lot about work with children. I would suggest, and he would suggest, this is a human thing. It's not an age thing. So on the bottom, we have an adult who's emotionally regulated and starting off in that calm space, and another person who's starting off in alarm. And what you can see is, as we regulate, as we interact and develop that and work through that relationship component in rhythm and relationship, as he says, we can start to help them start to match our emotional regulation. Okay, and so you can start to see the person on the top who started dysregulated, right? They start to come down to calm. And the closer we are in that calm or alert stage, we are out of fight, flight, or freeze. We are able to access higher thinking processes. But as you can see in this next slide, if as the person who starts in, as the adult that he has here and the child on the top, if you interact with someone who's in alarm and you're already dysregulated, it actually leads to that explosion. We both escalate at the same time, and it's just not productive. So sometimes it might mean that I'm going to tap out. I'm going to say, you know what, I'm not the one right now. I'm not in a place to help and be, you know, to help someone else regulate, because I'm not there myself. But I can find someone who is. So important as leaders that we know where our resources are. We don't take everything on ourselves, and that we share in that. So this is another way to think of it. When we move into a traumatic experience, we move into our sympathetic nervous system. And when we discharge that trauma, right, sympathetic, that fight, flight, or freeze, when we discharge the trauma, we move back into our parasympathetic nervous system, right? So this is a way to think about it. This is our parasympathetic, rest and digest, right? Hopefully this is where you guys are right now. This is our sympathetic nervous system, fight, flight, or freeze. All of our information comes through our lower brain, right? That brain stem. And if our body says survival, we have to respond. This is what we do, fight, flight, or freeze. Everything else shuts off. So this is another way to think about it. We move into trauma occurs. We move into our sympathetic nervous system. It looks like this. We're able to discharge that trauma, to calm back down internally, and we move into rest and digest. Here's the risk. If you don't do that, if we don't have these moments of regulation, then we go into, you can see on that red, right? That's what we want to do when that symptom occurs. But when we're in when we are in fight, flight, and freeze too much, we get stuck in on or off. So fight, flight, or freeze. If someone is a fight person, they get stuck in on. So that means we all have a default. When stress occurs, when our body floods with adrenaline and our brain floods with cortisol, we go into one of these, right? So for those who are fight people, who go to fight, that's your default, you get stuck in on, right? Everything is outside of these lines, the parallel lines of kind of a level in which we can tolerate things. And we go into these extreme hypervigilance, rage, panic, hyperactivity. For those who are stuck in off, those are the people who might default to flight or freeze. And when we're stuck in off, this is extreme depression, disconnection, exhaustion. Either one of these just aren't sustainable. And unfortunately, this is what it looks like, right? That we never get out of it. Here's my concern for all of us. We are in a complex, toxic stress, traumatic, ongoing experience. If you don't find time during the day to let your body's levels of stress hormones, those adrenaline and cortisol levels, to come down, you will get stuck here. So important for you and your staff that we do this differently so that we can come out in a post-traumatic growth perspective. We don't want to realign our systems to these stuck in on or off positions, and we're at risk for it. So how do we do that? We focus on resilience, right? That ability to bounce back, to cope successfully with change, adversity, and risk. And we can all build our resilience and protective factors. And some of you even mentioned that, right? Yoga, going outside, connecting with family, hugging the baby, all of those things really build up our resilience. And so this is that reminder, right, that we are not working from home during a crisis. We are in the midst of a crisis trying to work. So important that we remember that's what we and our staff are doing. The other thing that I want to focus on for you guys as leaders is the idea in this adaptive leadership, this holding environment. One skill that we can really practice and lean into is being an active listener. An active listener is someone who is actually listening to understand as opposed to listening to respond. And unfortunately, as a culture, we default to responding all the time. So when we're actually actively participating into listening and really practicing active listening, and this is a skill that we can develop, that we can build on. This isn't a born with it or not kind of thing. So we listen with all of our senses, and we're really investing in the relationship with the person, and then we can actually make changes. Then we can actually engage in a productive way. So not listening to respond, listening to understand. This is what it looks like. The first component of active listening is actually reflective listening, just understanding what the person said. So you listen to the speaker, paraphrase, what I heard you saying is that correct? If not, what did I miss? And staying there until they have really conveyed everything that they want to convey. How would we know that? Because after I've verified what I've heard them say, I'm actually going to ask them, is that correct? Is there anything else you'd like to add? And I'm going to continue listening until they say, nope, I've now shared with you all of the information that I want to share. We too frequently, because we're listening to respond, jump in the middle before they've shared with us all of the information that they want us to know. So very simply, sounds simple, hard to practice. What I hear you saying is that correct? Is there anything else you'd like to add? And if I didn't respond or repeat that correctly, what did I miss? So going through that ongoing until we have really gotten to the point where they say, I have nothing else to add. Then what do we do with that information? Here's the hard part. Active listening is actually responding only to what you heard, which means if I haven't asked your opinion as a speaker, you can't give it. If I haven't asked you a question, you can't answer it. We can only lean into the relationship and getting to be more curious about the person who's sharing information until they actively engage us and ask for our participation. Otherwise, they're asking us just to be present to understand what they're sharing with us. Very, very different than our practice of listening to respond. So I would encourage you as leaders to really lean into this practice and pay attention to if someone's not asking your opinion, making sure we're not giving it. If they're not asking a question, that we're not answering that. and that we're really leaning into being much more curious about what that person is trying to share with us and gaining more information and details about their perspective on what they're sharing. The other piece that I have for you guys as leaders are these different slides from the Anxiety and Depression Association of America. And so what does that mean? So what they've added here are 3 different sections. Things in terms of what we can do with our mind. So when dealing with stress and anxiety, right? Accepting things that we can't control, maintaining that positive attitude, doing our best, understanding we're never going to be perfect. And as leaders, if we try to project perfection, then we're expecting our staff to do that. And it's just not realistic. We are only human. We all have our strengths and weaknesses. So important that we lean into those so that our staff can lean into those as well. And then this understanding what our own triggers are for anxiety, really, really important. They also talk about the body, so limiting alcohol and caffeine during this time. I absolutely recognize that sometimes that's how we cope, and we need to make sure that, especially for long-term coping, this wasn't a one-time, couple weeks we dealt with it and got through it. This is prolonged, and so please make sure that you're taking care of your body, because again, it's the only one you're going to have at the end of this. And if we don't take care of it now, it's not going to be there for us when we need it afterwards. So getting enough sleep. We spend so much time talking to those that we serve about their sleep, about our clients and our patients. It's all human, right? We're human too. Please make sure that you are getting a regular, good sleep practice during this time. If you didn't have one before, now's the time to do it, because again, your body needs those reboots. You are in a toxic, chronic stress position right now, and we really need to make sure that we are taking care of ourselves and that our staff are, so we can come out the other side in that post-traumatic growth perspective. And then also actions, right? Practicing deep breathing, counting to 10. On here it says 20 if necessary. For those who are managing a lot at home, like I said to you, I got 4 boys. At one point, they all returned home from college. And so sometimes my 10, 20 was 30 or 40, all good, right? We just need to make sure that we're practicing that. And part of that is actually for our brain. Not only does it reduce those stress hormones, but it also sometimes, it can take 5, 10, 15 seconds for information to move from the lower part of our brain to our thinking part of our brain. And so sometimes it's really important to give ourselves that break before we respond to anything. The other things here, getting back to community. We've seen people, start bringing meals to those, or do shopping for those who can't get out, mowing lawns over the summer, walking dogs, connecting with people, writing letters, really making sure that we still continue to find purpose in the things that we're doing. Taking time out for yourself, accessing online resources, and please make sure that you're talking to people as well. And again, all of these resources are going to be not only on the slides when you get them, but we have a resource list at the end as well. Empowering tools, different things that we can do are, practicing those emotional regulation. You can see on here a lot of the stuff that we've talked about, but even creating a structure at the end of the day, right? Or in the morning, making sure that we, make our bed or get out of our PJs, connecting with people, really leaning into the creative arts, really different ways. I found myself in the beginning of, probably for the first month of working from home, and now I do it when I find myself kind of getting dysregulated. I've got a candle in my office that I put on. I put on spa music in the background. Sometimes I'll go out and just stand in the, in the sunshine for a couple minutes. So finding those things that really soothe you and make sure that you're doing those. And then this is actually Dr. Perry's arousal continuum that he referred to earlier in those slides. And, you know, one of the things that I love about this is kind of the top level and the bottom level, because it reminds me when I'm intervening with somebody else, when I'm interacting with someone else, depending on where they are in their internal state, as you can see on the top here, will impact right where they're cognitively responding. But it's also where they are in a sense of time. So if we're anywhere between alarm, fear, or terror, and the one way to read this is actually on the dissociative continuum. Those are our flight and freeze people. And on the arousal continuum, those are our default people to fight, right? So if anyone is over here on alarm, fear, or terror, their sense of time is anywhere from nothing to like minutes or hours. So if I have someone that I'm interacting with who's in that place, in crisis, and I want to talk to them about, like, if you keep acting like this a week from now, you're not going to be able, a month from now, in your performance, like, all of those long-term discussions are irrelevant. Their brain isn't even able to process past what's going on really in this moment and in the next couple minutes or hours. So the whole goal between if someone is in that alarm, fear, or terror stage is just to help them emotionally regulate, because there's nothing else productive that's going on. So I want to really focus my larger, deeper conversations when someone's in that calm state and maybe an alert. But recognizing where they are and then how I intervene as a leader is really, really going to be important. Here's the other piece. Where am I on this continuum? Because if I am not in calm or alert, I'm not going to be emotionally regulated enough to help someone else get out of that place. And so this is where we talk about tapping out, right? Reaching out to your other resources. So important during this time. And so this is why I love this chart, because it really can help me kind of focus on understanding where someone else is and also where I am during this time and what my strengths might be and ability to help. This also just recognizes that when we are in fight, flight, or freeze, we are not able to respond, learn, or process. So please recognize during a crisis what really is feasible to do and where we need to focus. You know, so important. The other thing that Dr. Perry talks about, and Dr. Bruce Perry actually is the author of the book, The Boy Who Was Raised as a Dog. That chart is in the back of that book. And again, the resources for all of these and all the references are on the slides when you get them. He talks a lot about the importance of these 6 R's, having our interventions when someone is dysregulated, when they're in alarm, fear, or terror, that we are the way to get out of that. How do we intervene? What do we do, right? That whatever we do to impact the lower brain, to soothe the lower brain, to slow down those stress hormones, if we put it into these 6 R's, we're headed in the right direction. So rhythmic, that the intervention is rhythmic, repetitive, relational, relevant, rewarding, and respectful. So what does that look like? Well, rhythmic, you can see on here drums, rocking chairs, people who knit, right? That's repetitive. It's a connection. It means something to me. It's relevant. It's age appropriate. You know, how are we engaging in those things? You can see on here dance, Play-Doh, different types of lower brain engagement things. But this is what I really like in this next slide from Dr. Perry for leaders. He has translated those 6 R's into how to engage them in a positive workplace environment. So when we translate them from just engaging that lower brain, here are ways in which we as leaders can bring this into the workplace. making sure that things are relevant, that they match the skill level of the person that's doing them. Rhythmic, that they resonate with those neural patterns. And our rhythm actually comes from our mother's heartbeat. So that's where that natural pacing for things comes in. If we are stressed out and we're moving too fast and our body starts to get dysregulated, right, and it's not following those neural patterns, and again, my brain goes offline. And so I'm not able to really do what I need to do. Predictable routines and rituals, consistent and predictable things in relationship. Safety is so important. Moral safety, psychological, physical safety, all of those. And then rewarding, that it's meaningful and fairly compensated and respectful at all times to the person, to the team, and to their culture. And so I'm going to leave you with these three things. Different ways in which you can support your staff. Making sure that you're monitoring secondary traumatic stress symptoms, allowing them time to be with their family, their friends, and those that connect with. Making sure that you have self-care strategies inserted into your daily work activities, practicing that media distancing, and then also providing really healthy relationships. You know, as you're regulated, as you're a healthy connection, you can really help support your staff and be one of the positives in their life and in their time during COVID. These are the different components of resilience in which we can start to build. And again, you guys will have access to these slides. So I'm not going to read through all of them, but really important that we're building those skills. And then finally, we are actually attaching for you this Rapid Cycle Adaptive Leadership Journal. There's so much happening during this time that we also can't keep focus on it. And so one way to start looking at that is looking at kind of what were my biggest successes and biggest challenges today, getting a recording of that in real time. The bottom of this says a year from now, I want to remember that this is the week that blank happened. Put these aside after you filled them out each week. And then when you have a place to reflect and start to do your own CQI process, you can come back to these sheets. And again, we will attach this. And so I want to give time, we don't have much time here, but some time to just, if there are questions or Casey, if there were some themes that would be helpful to kind of review or highlight in some of the questions.
Sure. Let's see. Now that school is back in, a lot of people are working even longer hours, and it's leading to a lot of exhaustion. I think there's just a lot of exhaustion generally. What are some ways to help yourself and also help each other dealing with this kind of exhaustion?
Yeah, you know, I think it is so important that we take breaks. I think it's really easy to get to this exhaustion period. We've got too much that we're dealing with. So I would say scale back expectations and maybe realign the way that we're working. And were you saying that in this hybrid where some people are going into the office and some people were working from home, is that what's starting to create some of the exhaustion?
Yeah, just like a general trend of exhaustion across the board.
Which is perfectly understandable. I think we need to reevaluate our expectations and our work schedules. And, you know, coming out of this better normal where we're headed are going to be some of those lessons learned that we just can't keep pushing through during this type of complex trauma. So also infusing breaks throughout the day, setting up a comfort room in your office for those who are in the office, those emotional regulation, realign meetings so that you're not going from one to the other, but building in those breaks and building in those moments for regulation is going to be so important to get out through the other side of this.
Great. And let's just do one more question because this has come up a lot. Could you just redefine moral injury, moral safety, all of these terms one more time?
In 2 minutes or less, huh? Moral safety is creating an environment where we can talk about the difficult things. An example of moral injury might be when my moral code and what I'm asked to do at work conflict. For example, last week we talked about, if you have a client, excuse me, who has COVID-19, and you know that, and they go into work. Do you as a provider report them to public health? Or do you let them go into work knowing that if you report them, that they're not going to be able to go to work, that they will be out of work and not be able to provide for their family? When we have to choose between helping our children at school during the day because they're home and attending a meeting for work, that choice can create moral injury. Talking about implicit and explicit hypocrisy, right? Being able to voice and having those difficult conversations creates a morally safe place. Moral injury occurs when we have an institution that we put our faith in to do the right thing and they don't, and how we manage in between that. So right now, moral injury is a huge issue. It's highlighted in everything that we're managing. For those in public health, when you give your scientific belief and you're countered with a threat to your life because of a different belief that someone else has and that they're in, recognize our communities are in the midst of complex trauma. Most people are functioning in fight, flight, or freeze as a default. And so the responses that we're getting are not logical responses. The responses that we're getting are not thought through, highly cognitive thoughts, because people are just not at that place because of this prolonged trauma.
Great, thank you so much, Lisa. Unfortunately, we are a little bit over time, so I think we'll have to stop here. But thank you so much for sharing all of your knowledge and expertise and all these really great resources. So as a reminder to everyone, the slides and recording will be archived. We'll also share all of these resources again with you. And we also hope that you'll join us for our next webinar in this series discussing self-care and resiliency to help avoid COVID-19 burnout. I put the registration link in the chat box, and you can also access it on the slide deck once it's sent out to all of you. So thank you everyone for joining, and have a great rest of your day and week.